About 10,000 to 12,000 children are diagnosed with cancer in the U.S. each year. And according to recent studies, as many as 10% of childhood cancers may be inherited, leading to a growing number of pediatric cancer centers charting new territory in managing cases of hereditary cancer. Joining us now to discuss is WSJ science reporter Ron Winslow. Ron, it's so good to see you. Genomic studies are just giving us such a wealth of new information, including the ability to figure out where some of these childhood cancers are coming from, correct?
Right. It's been a mystery for a long time, and in the past, there's been several good studies, and two fairly recently that have put this number at 10%, in which doctors have sequenced the DNA of the tumor of the child and also their normal DNA, and then the DNA of the parents to find out if there's any connection in that way.
So if they do find a mutation, does that mean the child is likely to get cancer, or it just means an increased risk?
Well, it could be both of those things, but it's an increased risk. It's not an automatic. Genomics are, we'll sometimes think of them as a very binary kind of thing, a yes or no, but oftentimes it's much more probability.
Right.
But certainly there are certain mutations in like a retinoblastoma gene. That's pretty much a high likelihood, I think, of you're going to get cancer. There are others that it's maybe 1 in 4, 1 in 5 chances.
So are doctors doing these genomic or these DNA analysis preemptively, or are they doing it in response to a tumor?
So I think usually it happens when a child comes in with a diagnosis, and it would happen mostly at a major pediatric cancer center, a place that specializes in this. It wouldn't happen in a normal doctor's office,
Sure.
Regular doctor visit. But there's just recognition that it might be hereditary, and so there may be information that would help treat that particular child. But as important is that maybe that child's siblings are at risk, or even perhaps a parent is at risk and hasn't really been aware of that yet.
Such important information. Now, St. Jude's Children's Research Hospital is at the forefront of some of this, correct?
Yes, they are.
Tell us about their center and what goes on there.
So, I mean, that's what they do. First of all, they did one of these studies. They looked at more than 1,100 kids and their tumors, and tested their parents to find this almost 10% rate of hereditary cancer. And so then they will, so if a child is diagnosed, they will determine whether it's a good idea, maybe recommend their parents to have the testing. Lots of times, I think in many cases, parents are very willing to have their child tested because they want to know what's going on.
Sure, they want to know, absolutely.
But it does get a little trickier sometimes to go, how much of the family you want to get involved and so forth.
Does any of this lead to a change in treatment?
It can, yes. I mean, there may be differences in radiation, differences in doses.
Right.
Yeah, so it definitely can affect treatment.
Now, we mentioned that 10 to 12,000 children a year roughly are diagnosed with cancer. What is the good news here, though? You say almost 80% are cured of this cancer?
Yes. Over the past, 3 or 4 decades in particular, the progress in pediatric cancer has been really remarkable. Mostly, or at least a lot of experts attribute this to the fact that most kids do end up in cancer centers, get into clinical trials, so they're part of the process of getting new information. But this last 20% has still been kind of a tough nut to crack, and they're hopeful that this sort of information around genetics will help improve that track record.
We're all hopeful. Ron Winslow, thank you so much for that.
Glad to be here. Thank you.